As you're getting dressed this morning, you're thinking about what to wear, you might want to put on something red. And as you've noticed, all of us here at Local 3 are wearing red on this Go Red Day. It's on the first Friday of February, where everyone is encouraged to wear red to raise awareness that heart disease remains the leading cause of death, especially among women. I'm joined now by Jocelyn Trzynski, Vice President of Cardiovascular Services with Park Ridge Health System. Jocelyn, thank you so much for being here this morning.
Absolutely. Thanks for having me.
So this wearing red, it's a visual reminder about conversations over heart health. Why are these conversations so important?
These conversations are important because they empower us to take control of our health. That empowers us to know steps to take for prevention, screening, and things we can do to change our heart healthy habits.
Yeah, we hear a lot of the phrase "go red for women." So why is there extra emphasis put on women when talking about heart health?
So a lot of times we think of cardiovascular disease as a man's issue, but in reality, us as women are at equal or even greater risk for cardiovascular disease and even cardiovascular events such as a heart attack. The main difference between men and women, though, is that women, our signs and symptoms of a heart attack often appear in subtle ways. And so it's so important as a female to listen to your body. You know your body best. And so those subtle signs such as heartburn, indigestion, fatigue even, and a back pain can be signs and symptoms of a heart attack.
Yeah, and it can be hard because a lot of women have a lot of responsibilities. They're trying to take care of everyone in their families and their lives, and so sometimes it's hard to focus on yourself, you know? So let's talk about, we also hear the phrase of know your numbers. What does that mean?
So knowing your numbers is essentially knowing what your heart risk numbers are. Knowledge is power, and so we can't fix things if we don't know there's an issue. And so knowing numbers such as your blood pressure, your cholesterol level, your blood sugar level, and even your body mass index will help you start making changes that can be little, but have an impact to decrease your risk for a cardiovascular event.
Yeah. So if someone is watching this and maybe they don't know where to start to kind of take control of their heart health, what's something that they can do maybe later today to kind of start moving in that direction?
You know, these changes in life to decrease your cardiovascular risk don't have to be big. It can mean going on a walk on your lunch break today, doing something for yourself. Stress is a big component of cardiovascular risk, and so taking time for yourself today is a good thing to remember on Go Red Day.
Yeah. All right. Well, thank you so much for being here this morning.
Absolutely.
If you want to learn more about how you can take care of your heart health, you can go to parkridgehealth.com. There's lots of information on there. And also just start a conversation with your doctor.
Absolutely.
All right. Jocelyn, thank you so much for joining us.